We'll get started. Thank you for coming. It's Friday, January 15th, and I'm Mayor John Vieau. I'm here with an update from the city of Chicopee. The update is going to focus on testing, vaccine in our schools. Testing, vaccines, vaccinations, and our schools. Three separate categories, just to be very clear. On that note, I want to thank the city officials who are here. I know we have City Councilor at Large Jerry Roy. Thank you for coming in support. We have City Councilor Lucian Galecki here in support. We have City Councilor Stan Welzak here in support. Thank you for that. I know that I'm also joined by our Police Chief, William Jebb, our Fire Chief, Dan Stamborski. Thank you, Dan. Thank you, Chief Jebb, for being here. We have our Health Director, Lisa Sanders, who's going to share some updates from the City of Chicopee. We have our Office of Safety and Compliance here, Ella Soja. We have the Superintendent of Schools, Lynn Clark, here with me as well. And I believe our Department of Public Health Director, Lisa Sanders. And I think I hit everyone who's here. So thank you for joining me. And I want to thank the media for being here to help get this message out, because I think it's really important. First message is about testing and our test site. With students returning to school on Tuesday, January 19th, we felt obligated to move our test site. We found a very appropriate location. We will be moving to the Council on Aging at 5 West Main Street. That's the River Mills Center on the upper level. To facilitate the testing and to keep traffic interruption to a minimum, we will have vehicles lining up on West Main Street, entering at the intersection of Grove and West Main, and going in front of the former Uniroyal property to access the test site. In observation of our beloved civil rights leader, Martin Luther King, we will not be open on Monday. That's Monday, January 18th. So our test site for the week will be running Tuesday, January 19th from 8 a.m. till noon, and Wednesday, January 20th from 8 a.m. until noon. We will then resume on Monday, the 25th, from 8 a.m. Monday, Tuesday, Wednesday, or as deemed necessary based on demand, for those 3 days, on the 25th, 26th, and 27th. So just to be clear, the message is we will not have testing available on Martin Luther King Day in observance of one of America's most beloved activists and civil rights leader. I think it's appropriate that we celebrate that holiday. On that note, I know that Lisa Sanders is here, the director of our health department, to talk about Chicopee's numbers and where we're at, to give you a synopsis of how we're handling the coronavirus here in the city of Chicopee.
Thank you, Mayor. Good afternoon, everyone. As of today, this is where our numbers are. We have 23 deaths, 498 active cases. We have 99 people that we have grouped in our NA category. We have 2,175 people that have recovered, for a total of 2,795. I would just like to reiterate what the mayor said. We need to finish strong and crush COVID here in Chicopee. We have a testing site. If you have been exposed or if you are feeling ill, please use our testing site. It is free. I heard that it runs wonderfully well. The turnaround time is usually between 24 and 48 hours, so I really encourage that people use it. We have been in this for such a long time. There is a light at the end of the tunnel. We have a vaccine task force. We are exploring all avenues, and when we get our hands on the vaccine, we will get it out to our residents. Thank you.
Thank you, Director Sanders. On that note, I just wanted to caveat a little bit on that. When you talk about the test site, just to be very clear with the general public, the reason why we have ours is for Chicopee residents, first responders in Western Mass, the Sheriff's Department, and others who need it. That please reach out if you need a test. Call my office, and we can try to get you one. on that goal. Our goal is to get the message out to the people that it is available, and that's how you're going to curb this virus here in the city. Knowing that you are COVID positive, you are then ordered to go home and quarantine for a minimum of 10 days. That is how we're going to get our numbers under control here in the city. So that's the whole intent, is to let you know that you are positive so you will quarantine. If we get people out of the general public who are testing positive and spreading the virus, then our numbers and hopefully we can get back to a new normal as vaccines are rolling out. And that's where I'm leading into next, is vaccine. Here in the city of Chicopee, we've put together a vaccine task force that's been meeting regularly, and we are prepared to assist the state in any way that we can. Right now, as everyone does know, that the vaccine is available and has been available to COVID-facing healthcare workers first. That was the first week. And now we're heading into long-term care facilities. Our first responders started on Monday, receiving vaccines in cohorts of small groups to make sure that we keep people safe and keep them healthy, and also be able to provide the services that we always provide. Our nursing staff has been receiving the vaccine as well. So our goal is to get people vaccinated, get the vaccinations to these people as quick as we can. But we have to follow the guidelines and follow the lead of the state. Just to be very clear, for numbers, there's only been 20,200 vaccines available in Hampden County. And that's information, that's the newest information that was available last night for Thursday, January 14th. Knowing that, I'm just going to go a little bit deeper into this. People are calling the office. We are putting you on a list. We will try to get you vaccinated as soon as we can. There's talk about a regional vaccine site here in Western Mass, and we're waiting for them to identify that site. I know it's a work in progress as we speak for mass vaccination. The vaccination site for the Central and Eastern Mass vaccination is the Gillette Stadium, and we're expecting to have something very similar here in Western Mass, something within a 3-mile radius, so that we can get our people here vaccinated in a timely manner. But to be very clear, when you talk about the timeline, we don't see even our home-based care workers until February 1st. We're still in phase 1. So people are calling about phase 2. We're not there yet, and we have to be patient. So that's my message today. Please be patient. We understand that people want to receive this vaccine, but we have to make sure that first it's available, and then we're going to be able to find the best way to get it to you and get you vaccinated is our goal. To date in Massachusetts, there's just under 350,000 vaccines available. So if you do the math, with 20,000 in Hampden County, it's not available to the 56,000 people yet in the city of Chicopee. We have to be patient, and as it rolls out, we will keep you informed to the best of our ability of how and where you can get your vaccine. If you go to mass.gov/COVID vaccine, the information is there as who is eligible for vaccine at this time and where you can get it. And we will do our best as a community and as a task force to get those vaccines and get people vaccinated. And something that I just wanted to make sure everyone was aware, that we're doing everything in our power to make sure that we get our fair share of vaccines here in the city of Chicopee for our residents. On that note, I'd like to open up the podium to our superintendent of schools, who would like to talk a little bit about kids coming back to face-to-face learning that we're all excited about. Superintendent?
Thank you, Mayor. Thank you also to the viewing audience who's here with us today. As most of you know, on Tuesday, it is our plan to return preschool students, kindergarten, grade 1, and also the vulnerable and high needs students in all grade levels. That is a result of a recommendation from the Health Metrics Committee and also the medical professionals that we work with. A total of about 830 students, which is roughly about 11% of our total population, spread out over 15 different sites. These are some of the grades and classes that took part in in-school learning when we were in-person learning, when we were in person between September and November. The same staff members as well. As a school department, we would like to thank all the families out there for your partnership with us. We know this is taking a toll on students, families, and staff. But as promised, the safety and the students of staff during this public health crisis has been at the forefront of our minds. Over the past few months, we have had an outside contractor come in and look at the air quality of all of our sites. We've also had our in-house HVAC professionals test every classroom. And with the combination of the Univent and the HEPA filter, I am happy to say that all classroom spaces will be able to be over the 4.5 per hour air exchange rate. That would be in preschool through grade 8. Chicopee Comp, Chicopee High School, and DuPont do not need additional measures in order to get it up over that rate. I am also happy that we have enough HEPA filters for every classroom in this entire city of Chicopee. We are in possession of 575 HEPA filters, one per classroom. All classrooms will be operating at a reduced capacity in order to meet the 6 feet distancing guidelines. As you know, every Monday we send out a number of positive cases within each school community. And that would be, the numbers that we send out are a total of the staff and students with positive cases by school. We will continue to send those numbers out. I truly applaud the schools and enrichment learning centers within Chicopee that have been up and operating. Those facilities have helped support the science that tells us facilities such as schools are not super spreaders. With that said, I implore you to please work with us with the core 4. Mask wearing, physical distancing, hand washing, and sanitizing. Please help our students and staff stay safe by not sending your child to school if they are ill. I would encourage you, if they are ill, to utilize the testing made readily available to the residents of Chicopee. And as we prepare to return, if you have any questions, please know we are available. Reach out to building principals. Reach out to counselors who are available. Central office is available. And for those of you that are not invited back to in-person learning yet, we are currently working with the CEA on multiple committees. There are 2 meetings going on right now as we speak. One is health metrics, the other is implementation meeting. And we are working together to see what the second half of the school year will look like. Thank you for your support. Please stay healthy and reach out if you need us. Thank you. One last announcement, if I could, is you've seen a lot of correspondence from the schools and the school nurses about the flu vaccine and how it was necessary for school-age children to have it to return to in-person learning. As of today, that has been changed. They first extended the date to from December 31st to February 28th. They have recently, today, told us that it is no longer needed. So those requirements, we will be putting something out to everybody, but that is just today we were told that. Thank you. Thank you, Mayor.
Thank you. You know, right from the beginning, we've been trying to keep education active here in the city of Chicopee. We're very excited to have students back face-to-face in a classroom. And I can tell you, it's a testament to hours and hours and hours of hard work, negotiation to get to this point. So I want to thank Superintendent Clark, Scott Chapdelaine, our facilities director, for all of his team and their hard work to get our schools as safe as they possibly can be. I personally do believe that our schools are providing the safest learning environments that you can have, because of the hard work and the money that we've invested to not only make sure that all of our air quality is up to par, but also all the PPE is available, all the HEPA filters are in place, and frankly, we're disinfecting like we've never done. And we do that in every municipal building here in the city of Chicopee. And I will say this to the community out there and everyone who could be watching or will hear some form of a broadcast, that we really do need to finish strong as a city. There is a bright light at the end of the table, at the end of this tunnel, as we as a city collectively work together. We can get back to a new normal where we can get back to the things that we've missed last year and celebrate that like we've never done before. So I just want to thank all the department heads, all the support staff, all the task force for all the hours, recommendations, guidance, and everything that you've done to get us to this point, because we certainly couldn't do it alone. And it is a team effort here in Chicopee. Our goal was to save lives right from the beginning, and I think we've done a great job of that. I want to take a moment to thank our residents, the people who are out there every day, for doing their part by wearing their mask and going through the core 4. She stole my thunder by, that was my ending, that we need to wear our masks, we need to social distance, we really need to sanitize whenever you can, and please, if you're not feeling well, stay home. I think that's really the key component to all this. If you don't feel well, please do not go out there in the general public, and take advantage of our test site. It is free, and it's available for you, the residents here in the city of Chicopee. On that note, I'll open up to any questions if anyone has any. That concludes the briefing, and I'd be glad to answer any questions. If I can't, I'm sure my support team can. Thank you everyone for coming on a Friday afternoon. It really helps to get the messaging out, and I think that's the key component to this, is getting our message out to the public. We will be doing a reverse 911 call to let people know about our testing, and hopefully this message is getting out to the general public. So thank you for coming, and everyone have a great weekend, and we'll see you back next week. Thank you.